we're going to go over all the vessels that are listed here, the ones you need to know, and I'll also tell you ones that we won't have to have you know. So if you look here, and this is on the heart, so it says coronary arteries are the first thing, right? Coronary arteries, you can see they're going to be on the heart itself. There'll be see the little red vessels right there. So those would be your coronary arteries. And it's going to be as simple as that. If you see a blood vessel on the heart, we don't think you have cardiac veins, but veins would be blue, the arteries would be red. Next thing you have is the aorta. Now the aorta, what it does is it comes out of the top of the heart and arches over, and you can kind of see it right here. It's arching over, then going down. And I think the best way to see this, I got to be careful because those are really sharp ribs. Oh, you don't have this dissected, so I'm going to have to do just a very quick. Some of what you did is really good, and these have not been dissected out. But what I'm doing here is opening up the pleural membrane next to each one of the intercostal arteries. So now you can see it, right? So I got to get that to. I don't want to hurt myself, but let's do this. That's better. I know, I heard it too. So great, here's your aorta coming down, thoracic aorta. Here are the intercostal arteries on both sides. You can see them very well. And then we'll talk about, as we go through the diaphragm, this is traveling through the diaphragm right here, going in now to the abdominal aorta down below. So we go to the next thing, pulmonary trunk, pulmonary arteries. I'm not going to ask you to know those. And the reason why is because they come directly off of the heart, and then the pulmonary trunk goes upward, but they go into the lungs. So the arteries are going to be here, and then on this side, right down here. And actually there's some here, but we won't test you on them. Those are pretty good. That's some of the better ones I've seen in a while. And then right brachiocephalic artery. So the brachiocephalic artery is on the right side. If you'll notice here, the aorta comes up and then arches. This main vessel coming up right here, that's a brachiocephalic trunk. What you're going to see, a little bit different in a human than it is in a cat, but what you're going to see on the cat is you're going to see coming off the brachiocephalic trunk. Remember, brachial means arm, cephalic means head. So this is the left common carotid artery coming upward, left common carotid. It's not completely dissected off of here, but there it is as well. And then the right common carotid artery is right here. And just so you know, that's the vagus nerve setting right with it. The little white thing, you see the white thing right there? That's vagus nerve with it. So that's right common carotid artery. And then the right subclavian artery is this dude right here. So subclavian. So these are going into the head, the cephalic part, and then this is going to the arm, the brachial portion, and that's why we call it brachiocephalic. So then the next thing you have left subclavian, right subclavian arteries. So the way we do this, we say, here, this is going to be the subclavian. You can see it on the left-hand side going up, and it's going to swing around just above the rib here, and it's going to go then out into the upper extremity. You can see the red right there. See the red? Okay. So here we're going to call this the subclavian. We call it subclavian. That means underneath the clavicle, but it's labeled the subclavian until we get through or past the first rib. Once we get past the first rib, we're now in the armpit region. We'll call this the axillary, because armpit, axillary, the same thing. And then once we get past the inferior border of the teres major, then the axillary becomes actually the brachial. But I'm not going to ask that on the test. But so what I would say simply is if we tagged it right here, you would say subclavian. If we tag the one on the right-hand side, we would call this subclavian. Once we get past the ribs into the armpit region, we're going to call it axillary, and when we get down into the arm, then we'll call it brachial. Okay. And do they do the other one? So the other one has a really good radial and ulnar, but the radial is going to go off on the radial side, and the ulnar is going to stay more on this side. And I'm not saying this is going to be more radial right here. You can see a little branch of it there. Ulnar is going to go back behind, and you can kind of see it right here. See it right there? Okay, and then common carotids, we talked about those. Lingual arteries, we're not going to go up into the neck, or up into the base of the throat region, the pharyngeal region. So you're not going to have to worry about those. So don't worry about lingual artery. External carotid, yes. Actually, no, don't worry about external carotid. We're just going to go to commons. So common on the right is usually tied off. because this is where they do the injection for the arterial side. That red color is a latex dye that they stick in it. It provides the color, of course, and it makes those vessels a little bit more elastic, or more able for us as we're doing dissection to resist the tugging and tearing that we typically exert on those vessels. Vertebral arteries, sometimes we see them, sometimes we don't. They're going to come off like right about in here, and I won't test those, but they usually come off and they go directly back into the cervical region. Now, vertebral arteries are going to go into that transverse cervical frame, and remember, if you look at the cross section through a cervical vertebra, it's got the central canal where the cord sets, but they got these two little holes on the side, and all 7 cervical vertebrae have those. Those little holes on the side are called the transverse cervical foramen, and they are where the holes through which the vertebral arteries pass. Okay, so that's a specific characteristic of cervical vertebra that we don't see with the other vertebra, transverse cervical foramen, because the vertebral artery travels up in there, and I'm not seeing. It looks like it was here, probably cut. But and that's very common for that to happen. Sometimes we see beautiful ones, but I'm not seeing a great one here. That's probably it. That's not bad, but that's going to be probably it right there. Also, too, we want to be careful. See this little thread, this little piece of floss? This is going to be the phrenic nerve that's going to go down on both sides to the diaphragm. We don't want to destroy those. We want to keep them intact because they are actually what control the diaphragm and its ability to contract. We're not going to worry about costocervical trunks. You can scratch that off. Sometimes we can find thyrocervical. So thyrocervical is, now this is actually external jugular coming up. Thyrocervical is usually going to send a branch, this is more the vein side, send a branch over to the transverse, this would be like suprascapular and transverse cervical over here. And then there's usually a branch that comes off that goes up to the thyroid gland. That's why we call it the thyrocervical, because it comes up from the bottom, and this would actually probably be branches of the venous supply on that side. But I'm not going to ask you thyrocervical on or costocervical on the cat. We might do it on the cat, but we might do some of them maybe from those drawings or drawing like that. But I promise you we won't ask them on the cat. Next thing, internal mammary. Same thing as internal thoracic in humans. This is a great shot of them. You can see, and not so well on this side, but they're there. The artery and vein going along the inside of the thoracic cage there, but it's much more evident on this side. These would be your internal thoracic artery and vein, or internal mammary artery and vein, both sides. Axillary arteries, we talked about that before. We've got the subclavian here within the thoracic cavity. Okay, once we get past the ribs, first rib, now we call this axillary artery in the armpit, and when we get to the arm, then we call it the brachial artery. So, subscapular. Sometimes we'll find a good subscapular. The other cat I was looking at on Tuesday had a really good one, went back into that region, that subscapular region, and I'm seeing, looks like it's been torn here. That was it right there. See if we see it on the other side. All right, so there, this is where it usually goes. Well, here we go. So this is going to be subscapular artery, kind of this vessel right here, that artery right there. We might ask that on a picture, but not on the cat. I try to be relatively fair when it comes to the cat. The vessels are relatively large and easily identifiable. Then I would say that they're fair game on this, but some of these aren't, because you don't, unless you do a lot of this, it's hard to find out or find where they're actually traveling. But that's probably a pretty good, no, right there, going back in that space right there, underneath, this is latissimus dorsi, underneath latissimus dorsi, back in that region is subscapular. And those usually be an artery and vein for that. Brachial arteries, we talked about that. Artery in the arm, okay? Brachial artery here and vein, brachial artery and vein right there, axillary artery and vein right there. Radial artery, talked about those, and the ulnar arteries as well.